At the Evewell, we pride ourselves in making sure that every embryo that shows potential has been given the option to be utilised in your treatment. A lot of patients understandably want to know what happens to their eggs during and after the egg collection. We're really fortunate at the Evewell that the embryologist is present in the room at the egg collection, and we are next to the doctor as this process takes place. I think it's important to understand that embryologists work in hours, not in days. So we tend to do the egg collection 36 hours after you've been given your trigger injection. The reason those hours are so important is it actually determines what we need to do and when throughout the day of your egg collection procedure. Once the eggs are collected, the eggs are taken into the laboratory immediately, where they're put into culture, which essentially means into the incubators, where they are held to rest for up to 4 hours. If you are having egg freezing for your treatment option, the eggs will be in the freezer within 2 hours of them leaving your body, as they need to be in the freezer by 38 hours after trigger. If you are having treatment, whilst you're having your egg collection, we will be preparing your partner's or donor sperm in the lab, so that everything is ready for the point of what we term as the need to fertilise, which comes to us at about 40 hours after your egg collection. The sperm will then be used in the treatment process of either IVF or ICSI, depending on what the doctor has decided is the right course of action for you. And we will do that at 40 hours after your trigger. About 4 hours after the egg collection, we will make the embryos in the laboratory. What is the difference between IVF and ICSI? So IVF stands for in vitro fertilisation. It essentially means that we mix the sperm and the eggs together at that 40-hour interval, and we put the eggs and the sperm together back in the incubator. And in essence, we allow nature to take its course, and we hope that the sperm fertilises the egg naturally. ICSI is essentially when we will select an individual sperm and put that sperm directly with a needle into each egg, in the hope that fertilisation is achieved that way. The main fundamental reasons that we would decide that ICSI is probably the right course of treatment for you, if we are worried that you have been trying to conceive for a number of years and there has been no conceptions at all. If on the day the sperm count doesn't look as good as we want it to, we can convert to using ICSI from an IVF treatment plan. I think it's really important to note that ICSI is not a choice of treatment to increase fertilisation rate. IVF is a very appropriate choice of treatment if it is the appropriate choice for you. So once the fertilisation has been achieved, either through IVF or ICSI, those brand new embryos are put into the time-lapse incubators. We are now on day 1, which is the day after the egg collection, where we can see the initial signs of how many of those eggs have achieved fertilisation. We will then grow those embryos for 5, 6 or 7 days, and what we are hoping to achieve is that embryo forms into what is called a blastocyst. The blastocyst is a stage of embryo development that needs to be achieved for a pregnancy to be possible. Sometimes embryos can take 5 days to grow, sometimes they can take 7. It's an incredibly nuanced procedure, and we have lots of updates and information from the time-lapse incubators throughout that journey that enables us to help pick the best blastocyst to be transferred or frozen. In regards to embryo grading, at the Evewell we believe that every embryo should be given the opportunity to create a pregnancy. We know that higher quality embryos definitely correlate to more pregnancies and live births. Equally, lower quality embryos can still result in that magical outcome. So at the Evewell, we pride ourselves in making sure that every embryo that shows potential has been given the option to be utilised in your treatment. Embryo grading is just part of the puzzle. Sometimes we use PGTA testing to determine the genetic health of embryos. Your context is important on us understanding your overall potential of any of your embryos creating a live birth. The day that the embryo reached the blastocyst stage is also crucially important. Your doctor is vital in making sure that your stimulation protocol is bespoke to you and that it goes to plan. The nursing team are exceptional at making sure that you understand all the instructions given to you and they take you through the process. But once that is done, once the eggs are collected and the sperm is in the lab, it really is over to the embryology team to make this work. Embryos are created solely by embryologists. We are in many clinics and at the Evewell in a basement, isolated from the rest of the clinic to ensure that we are 100% focused. We are responsible for the best fertilisation rates, the culture and development of good embryos, and ultimately a lot of the success lies with us. So it's important to understand who your embryology team are and why they're so important in your journey, in your route to parenthood.